advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Doreen Granpeesheh is Dr. Doreen is an expert in autism. Doreen Granpeesheh. Dr. Granpeesheh. Doreen Granpeesheh. Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask questions on Ask Dr. Doreen.
Varsha's given us a little bit more information, sending her a hug. She says, I'm Varsha. I am facing challenges while running an inclusive school in Patna, Bihar. I don't even know where that is. Can you please give me a clue as to where that is? I'm geographically challenged. Where I educate special children. One of the difficulties I encounter is that parents believe that their children will miraculously improve once they start attending school. But despite everyone's hard work, the progress is not as quick. It is known that these children cannot improve rapidly and they are leaving school. What could be a strategy to make them understand? It's in India. Wonderful.
Yeah.
And I mentioned at the beginning that I am now explaining it to people saying, you know, how many hours, if you contracted with me to help your child to learn a language that they don't know, how many hours would you expect that to take?
Yeah.
I don't know why we sort of understand that.
Yeah.
Because we all know what it takes to learn another language and that it's not something you learn overnight.
No, I mean, for some kids it is, and for other kids it's not. Like, this really goes back to the individualization of skills and capabilities. And so to answer this question, I would say if you are responsible for a group of children, it would really benefit you to go on, get a license to Skills.
Yeah.
The whole Skills is the platform, the curriculum that we built for CARD. And the reason, if you really want to think about it, that what we did, which was very important, I think, is that we produced a assessment. And I think that's what would benefit you, because the assessment is not, it's, you know, so first it started out with like, I really want to get to know every single child. They're so different from each other, and I want to figure out what this child's needs are. What are these child's strengths and weaknesses in all the different areas of functioning, right? Skills starts with an assessment, and it asks you questions in language, play, cognitive, executive functions, academic, motor, social. I mean, you name it, it's everything that you would ever need, right? Every behavior. And then once you've established this kind of yes, no, my child can do this, and you have a picture of the child, what Skills gives you is a standardized kind of baseline to compare it to, which we did over many years. We validated it. And that's really, really important, because what that is essentially all the different, like, your child does this at this chronological age, this is what they should be doing. So if these are the things that a child of your age should be doing and your child is here, we have to teach these things. And that's, I think, what would be very useful to you if you're seeing multiple children. Because the most important thing with autism is it's very individualized. Whatever you teach is individualized, not just in terms of content that you're teaching, but also in terms of how the child learns. We were just talking about this. Some children are visual, auditory, they need more reinforcers, less, the timing is different for each child, all that sort of stuff. But you know, there are some children who learn pretty rapidly, let's face it. And then I took a child from like being non-vocal to completely finishing and being mainstreamed. That was the shortest I've ever done, in about 18 months. Yeah. And so it's kind of like that it can happen, and then you can also go with a child for 10 years.
But you didn't do that in 10 hours a week. Let's be clear about that.
No, that was a very intense. That was massively intense, yeah.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.